The advice and opinions expressed by Dr. Grant Pichet and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Grant-Pichet is the
Dr. Doreen is an expert in autism. Doreen Grant-Pichet.
Dr. Grant-Pichet.
Dr. Doreen Grant-Pichet.
Dr. Doreen Grant-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Good morning and welcome to Ask Dr. Doreen. I'm Shannon Penrod and I am here with the fabulous Dr. Doreen Grant-Pichet.
Good morning.
How are you?
I'm good, thanks. How are you?
You're looking good in your pink.
Pink, yes.
Yes.
How are you feeling?
I'm
Better?
older.
Yes,
feeling older.
yes.
I'm feeling older, but you know what else is new? And the alternative is much worse.
Absolutely.
So I'm embracing. But we're here this morning because Dr. Grant-Pichet donates this time whenever possible, usually around once a week, and allows all of us to ask questions around the world. So we're live right now on Facebook, YouTube, and Twitter, and about a dozen other places. Our fabulous Chris Desmond is going to take us on a visual tour of where else you guys can connect with us. I want you to know that our starting topic today is how are treatment hours decided. We'll talk about that at length in a second, but that's just the starting topic. You guys can be writing in questions about absolutely anything your heart desires. Dr. Grant-Pichet is a true expert in the field of autism, and she will always ask you more questions. So we love when you're writing in on Facebook or YouTube or Twitter. You can always email me, whatever way is good for you to ask a question, but often you do have questions back. So,
yeah, absolutely. We want to be able to give advice that's helpful.
Yeah. And it's not the same, resources aren't the same everywhere. So,
Right.
you know, tell us what you're close to, and that'll help us to be able to figure out what might be available near you. I feel like I had about a dozen other things to say. I do want to say that we have two YouTube channels. There's Autism Live and there's Ask Dr. Doreen. Please go and subscribe to the Ask Dr. Doreen, subscribe to the podcast. If you like to watch and see, because I referenced that she's wearing beautiful pink today, if you want to see that, you can do that on any of the sites that we're live right now, but we archive all of those videos on YouTube. We really are in our 15th year now, which is insane. But so there's lots of content to look at and see. But then there are the podcasts, and we know that the majority of you like to listen in podcasts. I love that you take us with you. And there are several different ways to do that. You can go on pretty much any platform that there is and do the free download. Obviously, when you do the free download, there will be some advertising. I hope you're embracing that and saying, woohoo,
Yes.
they paid so that I don't have to. If that is in any way not your jam, then we do have another way that you can get the podcast ad-free. It's a small monthly cost of around $5. You can go to glow.fm/autismlive. Now, when you pay that $5, you get everything we do on the Autism Network. If we do a new show, it automatically comes to your inbox completely free of ads, and you can listen to it at your leisure. Or leisure, as some people say. I don't know which one is right. Okay, so having said that, I do have to give the disclaimer that there is, even though Dr. Grant-Pichet has been in this field for well more than 40, I think we're above 45 years now that you've been in this field.
46, yes.
46
Yes.
years. No one would believe that.
Mm-hmm.
There is a painting underneath your bed, I'm sure, that's aging for you. But you know, there's no one that I would trust more in this field to answer a question. However, in this format, it's impossible to give individual specific advice.
Right.
That's just something we all have to accept. But if you'll write in and tell her as much as possible about what's going on with you or somebody you love, and you know, ask the question, she will give you tons more information. And I know so many of you have written in over the years and said how epic and life-changing this has been for you guys to follow along. It really fills my heart when you guys write and tell us, and it's years later. I got a birthday video yesterday from one of our people that watched us in the first week of Autism Live.
Wow.
From their son singing happy birthday.
Oh my gosh.
And it just
That's
tore
so
me
amazing.
up. Tore me up.
That's awesome.
We love to hear from you guys. So in any case. And this is a kiddo that you know because you've answered questions many times. I'll show it to you later. Anyway,
I don't even remember, when would that be? What year would that be?
I think we started this in 2011.
Wow,
I know.
that's amazing.
That's a long time ago.
It really is.
My hair was
Wow.
brown. I was still
2011.
dyeing it then. It really was gray then. Let's be honest. Anyway, but it was a long, long time ago, many moons ago, and a lot has changed, let's say that. But today we're talking about how are treatment hours decided. We're going to start talking about that, then we'll talk about whatever. But I'm seeing a lot of parents right now who are very confused. That, you know, I can remember it felt a little bit like a windstorm. That, you know, when you finally get to the point where you get the diagnosis, which getting there is hard, right?
Yes.
But you get the diagnosis, and then it's like, well, what do I do now?
Yeah.
And there are all these voices that are swirling around you saying, well, you should do this and you should do that. And often you don't know. And I don't know that there's any other group that experiences what autism parents experience, in that you can have two professionals and they'll tell you to do the exact opposite things.
Yeah.
And say, oh, don't do that. Don't do that.
Yeah.
Do this instead. And I don't see that. You know, I think when your child has anything else going on, usually you have a team of people who help you, guide you through.
That's right.
It can be really difficult with autism. And then you get to the point where you're deciding on treatments, but, you know, you say, well, I want my child to speak, right? And they say, okay, so we're going to give you an hour of speech.
Right.
And that feels like, oh, you're going to give it to me? Oh, it's a gift. And that will be the thing that helps my child to speak, 1
Right.
hour of speech. And that's such a lie. It's such a lie.
It
I'm
is,
not going to call
yes,
it anything
yes.
else. That's craziness. And, oh, we'll give you, 45 minutes of OT. And I remember going, OT, occupational therapy. My child is not yet 3. I would like more speech, because I didn't know what OT was. I didn't know the value of that.
Right.
And then you get into ABA, and they give you a prescription, and often that's so much bigger.
Yeah.
And you go, that's just cuckoo for Cocoa Puffs.
Right. Right.
I remember very distinctly sitting in Logan Shepard's living room, and his mother saying to me, they're going to give your child a 40-hour prescription. And I remember I said, that's crazy.
Yeah.
He's not even 3 yet. That's a full-time job.
Yeah.
They're out of their minds.
Right.
And fortunately, because of where I was, they explained to me how that was not out of their mind. But I see a lot of parents who are like, and school at 3 legally has to offer a program, and parents are like, I don't know what all these things are. So, we're going to launch into some questions. But I feel like because I brought up, there was one that asked about the speech
So
and OT.
can I just sort of explain
Yeah.
the background of where all this comes
Absolutely.
from? So when therapy, so I'm going to go all the way back to the late 70s, right, and early 80s, when we started to do what back then was called behavior modification, and is now has changed to ABA, applied behavior analysis. And the idea was, we want to teach kids. We know that the kids need to learn a lot of stuff, and we want to teach them all of their waking hours. Why not? Because that's how typically developing kids learn. They learn all the time.
Yeah.
Right? So they learn by observation, they learn by modeling, they learn by just kind of their peers learning information, receiving, all of that, right? And so Lovas, who was kind of the pioneer in this field, basically thought, why not? Like, why not take advantage of every waking hour to make sure that the child is benefiting, is learning something useful? And if you think of ABA as the methodology that it works for kids with autism in terms of a teaching methodology, just look at it as a teaching methodology, then we have to figure out how to provide all waking hours. And so back then, the concept always included parents. It was never just, an ABA clinic is going to do this, therapists. but it always included a team of people, which the parent was one of the very important people in that team. And the idea was that all of the hours that the parent was not available, which means when the parent was working, the therapists would then be working with the child, and then when the parent was available, or one or the other of the parents, they would also contribute. So it would then be all waking hours.
Yeah.
So that's where the 40 hours came from, because 40 hours was when the parent was not available because they were working, right? It's a 40-hour-a-week job. So we would schedule therapists from UCLA to cover the duration of the day, and then the parent was completely trained, and then the parent would come home and also work with the child in the evenings and on the weekends, right? And so it was, and when I say work with, it wasn't necessarily all sitting down at a table and doing drills, but it was, you know, everything that the child had learned, we wanted to make sure the child is using in their environment, has been generalized to the community, etc. And it was the parent's job to do that. So if a child learned new words, it was the parent's job to use those words in the community so that the child would become more familiar and understand the use of language. And so that's where the 40 hours came from. But then, of course, you have to realize that back then, when the field was developing, we were developing this program or these techniques with very, very young children, because as I was speaking about this a couple of shows ago, it was really, the concept was, how many hours does a child need for their mental and chronological age to merge? And that was should still be the concept behind this type of teaching. You know, with typically developing kids, their mental age and chronological age is the same. So if I am 62, then my mental age is also 62. So that's just how, that's why mental age divided by chronological age times 100 is our IQ. So it's 1 times 100, right? But with our kids, what happens is their mental age slowly becomes lower and lower. As they age chronologically, they don't pick up as many skills and learning, so their mental age slows down while their chronological age is still going. So the goal of ABA is to not allow that to happen. The goal of ABA is to teach enough where the child is keeping up with peers. And so if you look at a very young child, in some cases that is possible, because you're intensely teaching the child, and the child is learning and keeping up and is not falling behind, right? But if you look at an older child, let's say a child who's 7, 8 years old or something, that may not be possible, or you may not necessarily, because when you're starting with an 8-year-old, let's say, and you have 2 or 3 years, you're supposed to teach them everything they need in, let's say, 2 years to function like a 10-year-old. Now you have 10 years of teaching that you're supposed to do in 2 years. And that becomes, you know, insurmountable, like very, very hard to do. So the idea of how many hours has a lot to do with what you want to teach and how much there is, right? So the more severely affected the child is, the more ABA they will need. The older they are, the more they will need, because they have more to catch up, right? But people don't think of it in those terms. Unfortunately, over time, it has now become, people think of ABA, like you said, Shannon, in the same way as they think about speech therapy, for instance, and they're like, hey, maybe, or some parents will say, my child doesn't have any challenging behaviors at all. I don't need ABA. ABA is not just about managing challenging behavior. ABA manages challenging behavior because it teaches all these positive skills that replace the challenging behavior. So when you look at dosage, and I love that you always refer to it as that, the ABA prescription or the treatment plan, that in my opinion, you really have to start with what does this child need?
Yeah.
How many areas are we trying to catch the child up? Or what are the most dire things we want to teach, and how fast can we do this? Right? I don't want to teach language over the next 10 years. I want to teach language now, because if I do teach language now, the child can benefit from it next year and the following year and so on.
I have two things that I want to add, well, maybe three. Very much present in my mind that the two moms who really together brought me to you, one of them was Logan Shepherd's mom, and the other one was Christina Adams, because Logan's mom gave me her book, Christina Adams' book.
Yes.
And both of them were very fond of saying the statement that you said to both of them: we're going to get your child caught up,
yeah,
and we're never
yeah.
going to let him fall behind again.
Right. I mean, that's what it is.
And I think for parents, that like cuts right to the chase.
Right.
Like that's really what we're talking about. But I also want to say too that a lot of times when we talk about your child doing this many hours, we think of it as work. And sometimes even the professionals will use the phrase work. But you are always at the forefront of saying it has to be fair, which means it's got to be fun for them. They are children.
And it is fun.
And I think that's the part that parents need to hear more about, because we think, oh my gosh, instead of going to Gymboree and going to the playground and all these things, my child is going to have to work.
Right.
And, done properly, it's everything that you had hoped for your child.
Right.
We all would love to take our child to that really expensive preschool that's got the highly trained people who make it so much fun, and your child is just immersed in this wonderful learning environment. Well, that's what it is.
Yeah.
That's, if it's done right, that's what ABA looks like, and that's what it is.
Right.
I don't remember what the third thing was.
Well, I mean,
So I've
and the
lost
other
it
part
now.
of, I guess, what you were talking about is also that when you put your child in a school program, let's say very early, they're not necessarily going to benefit as much as they would if they had some skills. And I always tell parents that, because parents are like, but I want him to learn social skills.
Yes.
And unfortunately, our kids don't necessarily pick up social skills just by going to school. They, in fact, may become more isolated because they can't understand what's going on, they can't express themselves, they can't figure out all the rules, so there's a lot of stuff that the child has to learn before, learn one-to-one, which is ABA, before they are immersed in a social environment.
Yeah. I believe in tough love. And I know what it's like as a parent, that you want that normal thing, and you want school, and your hope is if they go to school that they will automatically absorb these things from it.
Right.
But the tough love that I'm going to say to you guys, if your child were able to absorb those things at school, then your child wouldn't be having the difficulties that they're having now.
Absolutely.
And deciding that I'm going to entrust that.
Right.
I love school. I'm a former school teacher. I love teachers.
Right.
I love educators. But if you were to sit down with any 5 educators, pick the ones who win the awards, and if you sat 5 of them down and said, are you prepared to deal with autism in your classroom? They would go, no. Can you give me a program? Can you tell me how I can help a child that's not speaking? What do I do? They don't know that it's not part of their training.
Right.
It isn't. And it's not been shown scientifically to be effective. And that's when they have full funding, which they've never had, and now they have less funding than ever.
Right.
I'm begging and pleading you, if your child is under the age of 5 and especially if your child is not potty trained, and if your child is not speaking well enough to be able to advocate for themselves with no prompting, please don't choose school over ABA.
Absolutely, yes,
please.
honestly.
Okay, so let's launch into some questions, because I brought up the whole thing about speech and OT. So somebody said, why are we being offered so many hours of ABA and so few of speech? I would like my child to be speaking.
Yeah, that's a great question.
It is.
So I think it has to do with how these two fields came about. So speech came about because in a more without. Okay, so let me back up. ABA started with this incredible study that was 1987, and it was immediately comparing low dose and high dose. And it was just like, it took over the world when it came out, and it was like, whoa, If we do a lot, then children actually have an immense amount of benefit from this. So there's that, right? So there's an opening to the concept of this whole I can teach all waking hours, right? So, and I should be doing that.
And it works.
And it works. And that was the model of ABA. And from there, unfortunately, so we started up here, and now, unfortunately, it has watered down over the years only because it is being paid for by insurance companies and they don't want to pay. It's really simple.
Yeah.
So that's that. The model of speech did not come about with some explosive seminal study.
Right.
It actually was sort of just therapeutically, kind of like physical therapy, in the sense that, oh, there are these exercises that can be done to help children, not autistic children in general, and adults who have speech deficits develop speech. And whether they were motor exercises or they were other types of exercises, that vocal exercises, they all kind of led to improvement in the formation of speech patterns. And so there was no, and I'm not sure, I mean, at some point it became established that, if we just do this maybe 3 times a week, that's pretty good and that's intensive enough, or it'll get kids, sort of the expectation of the outcome was never as high as ABA's expectation of outcome.
Right.
Right? It was like, okay, I'm going to like correct intonation, or I'm going to correct enunciation, or whatever it was. But with ABA, it's so much more than just language development or speech development, because, with ABA, you're looking at the whole array of skills that an individual does during life, right? So speech and language is kind of one part of it, but you're also looking at teaching the individual different ways of thinking, that's the cognitive part, different ways of regulating their own behavior, that's the sort of inhibition executive functioning part, skills for playing, skills for motor development, skills for adaptive development, taking care of themselves, even academic development, so, and of course, how to behave in a group, so social development. And all of those are parts of an ABA program. Mm-hmm. So there's a way, way, way more to it, and that's why, obviously, you get a much more intensive dosage.
And, I want to say to parents that part of the reason why there's a little bit of a cookie cutter method now at schools, that schools, the norm is that they'll give your child 1 or 2 hours if it's really intensive, but that you'd be very lucky if you got 2 hours of speech at school.
Yes.
And that's just the norm.
Yes.
And everybody has accepted that as the giant turd on the plate.
Right.
Like, okay, that's what we're going to get, even though there's no study showing that that's really going to help your child with autism.
Right, or it's going to help your child enough. And that's the other thing, Shannon. I don't even think, like, if you were to say, like, let's do 40 hours of speech, I'm not sure that a curriculum exists that would give you enough content for a 40-hour-a-week program. You know what I mean? Whereas
exactly,
in ABA,
and it doesn't. Yeah,
it doesn't. So you'd be like, that you'd be repeating the same thing,
right,
which you never kind of want to do in general, because the child gets bored.
Right. Well, and while speech and language pathologists are amazingly highly trained people, they don't have a course in working on behavior either.
Right.
So they would have trouble teaching that much to a child. The child would engage in behaviors to vote and say, this is, I need something more fun. Right? So not proven to be effective. But on the other hand, and you were very humble when you said there was this study, because you were a part of that study.
Yeah.
In fact, to my mind, correct me if I'm wrong, I say this all the time though, of the original investigators, I believe you were the last person living.
Yeah, that could be. Well, okay, so John McCacken was also there.
Okay.
And John McCacken, who's part of Autism Partnership.
Okay.
So the group of us who were at UCLA working for Lovos, Tristram Smith, unfortunately, has passed away. But there were, so the work that was done for the study was done, it goes backwards in time many years before 87.
Okay.
And I joined the group in late 78.
Okay.
So when you look at the people who were there, McCacken was there. Whether or not he participated with the children who were part of the study, I'm not sure.
Right.
But I imagine he may
Might have.
have.
Okay.
Yeah, because it was a small clinic, Shannon.
Yeah.
It was a very small clinic. When I started, I think we had 9 kids.
Wow.
That was it. And what we were doing, a lot of the kids that we were studying were not part of, but there was a small group at UCLA, but we were all learning and working with kids at Camarillo State Hospital, because this
Yeah.
is before deinstitutionalization.
Right.
And then also, of course, there were kids at the Neuropsychiatric Institute of UCLA, so there were kids all over. So I'm trying to think who else would have been there. There was another individual who actually was my senior, so I worked for her for a little while. Her name was Tracy Parker. She was there. So I don't know where these guys are and whether or not they're still in the field.
Interesting.
But they were graduate students.
Okay.
Yeah.
But I love that you keep reminding all of us, because we've gotten so far away. And when I
yeah,
hear
yeah.
professionals, even BCBAs, talking about, well, it is shocking to me, because
Right.
I've lived in your world,
Right.
and I know, the things that you talk about, and they talk about this study, and I'm like, you weren't there, and you're misquoting.
Oh, no,
like,
absolutely.
it makes me crazy.
Absolutely. In fact, another person I just remembered is Bob Cagle.
Oh.
I don't know if people know this, but the Kegels
Yes.
who have clinics or in Santa Barbara, and now they're
Yeah.
at Stanford. Bob Cagle was a prior Lovaas student.
I did not know that.
Yeah, see, and Lynn Cagle, his wife,
Right.
is a speech therapist.
Yeah.
But Bob trained with Lovaas before me. So he had already left when I started in 78. But John McCacken and I graduated on the same day.
Interesting.
Yeah.
Well, a little bit of background.
Yeah,
I love that.
yeah.
Let's, we have a bunch more questions, and I need to check if Chris is sending me stuff. I'm not seeing anything, Chris, so. Okay, hi, Dr. Doreen. I have 2 kids with ASD. My daughter is 16, and she didn't get her diagnosis till she was 13 and having trouble at school. She did some ABA for a couple of years, like 10 hours a week. She's doing good. My son is 5. He just got his diagnosis, and they want to do 30 hours a week.
Yes, yes.
This is crazy to me. I'm fine doing around 10 like my daughter had, and they are acting like I'm crazy. What's up with that?
Yeah, that's really great. So, the fact that your daughter didn't get diagnosed until she was 13 already tells me that she was less affected by autism. In other words, she had not fallen back enough. She had not fallen behind as much as potentially your son is. Your son's getting diagnosed way earlier, which means that he has more symptoms, which basically means that he might be struggling more. He may have more of a language deficit. He may have more of a social deficit. Again, every prescription has to do with what that child needs. No 2 kids on the spectrum are the same. Their needs are different, completely different. So when you look at children, you always want to look at kind of how much of their bucket do I have to fill. That's really the way to look at it, right? And across all those areas that I mentioned. So, how much language does this child need? How much play skills? How many social skills? How many cognitive areas do I have to teach? Executive functioning, motor, adaptive, all that. So when you look at the child, there's these individual buckets, and depending on how much has to be taught, that's the current prescription. So, for your child, for your son, it's a gift if someone is saying that he needs 30 hours. Yeah. It's a gift. Take that gift and be very grateful for it, and take it seriously, because what they're saying is we're going to hit this hard, and your child will not have to deal with it later on or throughout their whole life. The more intensity you do right now, the less you have to do in the future. think of it that way.
Yeah.
The more you put in right now, it's like anything else. If you think about it, it's like learning a language, learning a chess, like
Yeah.
whatever it is. The more you do now, the less you will have to do in the future.
And I think part of what we want to get established today is that it is individual. Every Thursday morning, with a group of people, I lead the orientation for new parents at CARD. And my favorite part of the whole, it's a 1 hour thing, and I love the opportunity to get to do that every Thursday and welcome people in, because it was what was done for me.
Yes.
And it was what made it successful for me, was that it was a parent explaining to me, here's the truth, right?
Yes.
But there's a moment where we ask all of the parents to put in the chat what their prescription is for their child. And then we just read the numbers as they pop up.
Wow.
And I say to them, and the point of this is that I want you to hear that the numbers aren't all the same.
Right.
That your child's number, like somebody will write in 23, and somebody
Yes.
else will write in 34, and somebody will write in 40, and
Yes.
somebody will write 17 because they
Yes,
have a
yes.
17-year-old, right? And I go, this is because it is specific to your child.
Absolutely.
And that, I mean, even we'll have people that are coming with twins
Yes.
that are the same age, and one twin,
Is
has
more than
gotten
the other.
28, and the other one has gotten 36.
Yeah.
Right? And I say, so, like, let's realize
Right.
this is specific to your child. This is a very specific prescription that has meaning. That they didn't pull a number out of a hat.
Yeah.
They didn't go, well, oh, your child is 4. Let's reach and get the ducky out of the water and go,
Right.
oh, that says it's not some mystical thing. There's a process.
There is a process, but I also want people to realize that it is somewhat still there. We're trying to make it as objective as possible, but it is still somewhat subjective, and I want to explain that.
Okay.
So if I see a child, and let's say another clinician sees a child, we may recommend different hours. Why? Because we are trying to predict this individual's needs.
Okay.
So it's a little bit hard to do that, right? Because, as you know, children learn at different rates, right?
Yes.
And usually when you're recommending these hours, it's very, very early. I've just met the child. I've maybe done a 2 or 3 hour evaluation of the child, and I'm making a recommendation. So those recommendations should really be kind of honed in and perfected over the course of every few months,
Yeah.
right? The more you get to know the child, and it isn't uncommon, for me at least, that I will increase my recommendation once I get to know the child, because they're just not learning fast enough.
Okay.
And I need more time to figure out what I need to do. How do I get through to this child as they age? There's more stuff coming, or I recognize additional issues. Oh, this child has some days where they're learning fast, other days where they haven't gotten any sleep and they're not learning fast. So I'm going to need more hours. Like I said, it's just all about this. I need to teach this much.
Yeah.
And how can I do that in the most efficient way? That's what it is. And it depends on lots of factors. It depends on the parents and what they're doing at home.
Yes.
It depends on how well the child is learning. So
Yeah.
are they sleeping? Are they feeling well? Do they have pain? Do they have other things that might detract from
Yeah.
their ability to learn? Because the more aware and awake the child is, the less duration and intensity I need, because
Yeah.
they're soaking it all in, right? It depends on that. It depends on all the opportunities I want, if they're there at the right time. Like, do I have the right therapists in place? Do we find the right school
Absolutely.
once we're ready to integrate? Do we have all the opportunities? We want the child to get into play sessions with others. It depends on so much, Shannon, and that's why, there's not a ton of kids who go through it very successfully. You have to take care of all these variables at once.
Yeah.
That's why it's so valuable when you get parents involved, because the parent is kind of the master orchestrator of the whole thing, right?
Yeah.
The parent is the one that makes sure that people are doing what they're supposed to do. They're talking. The parent is like, oh, you know what? He did use this skill, but he didn't use that one. Or this is what's happening at school, or, you know, I think he needs a different school or a different classroom or a different teacher or a different program, or I don't see him learning this stuff, or, you know, this new behavior popped up, or whatever is going on, the parent is the one that's holding it all together, in my opinion, together with the help of the expert, who is the
Yeah.
BCBA.
And I agree with you, but unfortunately, in the beginning, the parents don't know enough.
Right.
And so,
Right.
you know, there's this whole thing about informed consent. And,
Yes.
and I'm saying yes to something, but can I truly be
Informed.
enough
Right,
to
right.
know what I'm saying yes to, which is always
Right.
the thing that I'm
Right.
rallying against, is to try to make parents really, really informed. And, you know, we're sitting there with an expert. So based on what you've said, I think it's important to remind parents that if you have gone and you got a number of hours for a prescription, and if part of you goes, I don't think this is enough, that you can ask, why did you decide these? You could potentially get a second opinion. I think what I've been hearing a lot lately is that I've been hearing from parents who they have a certain prescription, which to me is shockingly low, right? But then upon, you know, and I send people back and say, ask, why? But what a lot of them are coming back and saying to me is that they were told because the parent walked in and said, well, we have school and we have this and we have this and we have this. And so the person, doing the prescribing, lowered the hours based on the other things that they were doing before
Right.
asking the parent,
Right.
if you had the choice between these, which
What
one
would
would
you
you
do?
pick?
Well, and a lot of times the parents would still pick school because,
Absolutely.
as you said, they don't have the information. You know, like we, as individuals, always think my child has to go to school.
Right.
I mean, that's that, right?
Right.
And if you think about it, like how many things do we, you know, I always say to parents, when you have a child who has a lot of issues going on, a lot of deficits, a lot of challenging behaviors, I throw at the parents, if you had to choose between right now the child having play or language,
Yeah.
which would you choose, right? Because unfortunately, that's the scenario. It's like you only have a certain amount of time. And if our kids learned language from play, that would be a different thing. But unfortunately, they're not. And we have to teach them language, which is such an important component to the rest of life, everything. And parents will say, yeah, but he's, you know, and there's a lot of things, Shannon. In fact, one of our questions here, one of the viewers said, I don't think more hours of speech therapy would bring better results. The brain just needs enough dosage of input in order to have decent results. I'm not sure what decent results are.
I think decent results.
Oh,
is what
decent
that-
results. Okay.
yeah.
But so that is, you know, and that shows me that there's a misconception about ABA. Right?
Well, this
Because
is
I
for
think-
speech.
For
They're
speech.
saying speech, which
Right.
I think was what we were saying too. There's only so
Yes.
much speech you can do, but with ABA,
With ABA, this organization in the brain is also part of the program. So it's kind of like we're not just producing new material,
Yeah.
right? What you're doing is you produce the new material, you make sure that the child is learning it in a very organized fashion, in a way in their brain that they can retrieve it in multiple ways.
yeah,
I always give examples of that when I say, like, let's say you're teaching the concept blue. You're not just teaching this child to say blue.
Right.
That's just one way of teaching. You're teaching the child to identify blue objects. You're teaching them to be able to recall things that are blue, like the sky. You're teaching them to point to I mean, there's like multiple different ways that you teach that one concept, which
Yeah.
is also another reason you need so much time,
yeah,
right? Because you're trying to get the brain to classify it
Yeah.
in multiple different ways so that when you later ask the child something like, what color is the sky? They can retrieve that information. When you also ask them, what's your favorite color? They can retrieve it. Or what color is that block?
Right.
Like all of those will result in the same answer. And so you have to learn it in multiple ways.
absolutely. And I've got a question that we want to come to next, but I want to say, you know, I'm working really hard on the toy guide right now. And
Yes.
because I believe that, and I've watched our behavior technicians teach and involve play and really embed. So in the toy guide, you'll notice when it comes out, I always include a marble run. Always somewhere in the toy guide, it's like what's new, what's hot in marble runs, because I think it's a great example that, you know, when they were teaching my son things and he loved a marble run, and they would ask him, what do you want to, you know, get as your next reward? What do you want to play next? They would say to him. And he would point or say or do whatever, but a lot of times he would play for a marble to get it to run it down the marble run. And they would teach him something which would take, you know, maybe a minute and a half. They would teach that in a really fun way, and they'd be giving him high fives and, dude, you got it, you got it, you got it. Here's your marble. And then he would run over, and you would think, okay, this is a break.
Yes.
Right? That he's getting to play the marble, and he'd be like, I'm on a break, you know, I get to play the marble and do the thing. But they would always find a sneaky way to make whatever the lesson was a part of the marble run.
Right.
You know, that it was, whether it was the color blue.
Right.
So what color is the marble, Jem?
Right.
Which one's going to go faster? The blue, you know, this one or that one, the blue one.
Yeah.
You know, and so they would take it and do it very succinctly with him. He would be all excited. He, you know, achieved. He would get his reward, but then they would find a way to put it in his environment so that he had yet another way of learning the lesson and applying it. So the question...
Do you know what you just made me think of, Shannon? Sorry to interrupt you, but you just made me realize something else. You know, like, our kids in general, when they're growing up with autism, they are naturally, because they have a hard time understanding things that are going on around them, and B, because other kids are not very nice about it, right? So naturally, their self-esteem is affected in a negative way, right? Individuals who have any individual whose skills are they're struggling with a skill in society will tend to have some influence on their self-esteem, a negative influence. And part of ABA is rebuilding that. I mean, I don't think parents realize how much love and applause and just, you know, just incredible celebration of a child is involved in ABA, right? And I think that naturally also produces a certain sense of self-esteem in the child that, like, I can do this. Like, wow, you know, I am cool. I got this. And that is invaluable in and of itself.
Yes, you can't put a price tag on that. But the question that I was warming up to was, can you tell me what kinds of things happen during treatment? My daughter is 3, and they are asking for us to let her have 40 hours of treatment per week. This seems like too much. I don't want her to have no fun. Also, I want to be with her. We hear this from a lot of the parents when they have littles. She says, I'm not ready to not be with her. What will happen?
That's awesome. So this is great because I enjoy talking about a 3-year-old's program, right? So a 3-year-old, you would be 2, 3, 4, pretty much all the same. What you would be doing is, first of all, the program looks like this. So you'd have, let's say you're doing a 40-hour program. You want to divide it by 6 days a week, not necessarily 5, because you do want to cover some on the weekend. And so, you know, you want to be able to do something like 6 to 7 hours a day in order to cover the 40 hours. And some of that 40 hours is also sort of group meetings or, you know, people just sitting and making the plan for the next week. But the majority of it is direct one-to-one with the child. And so you're doing these hours, let's say you're doing 6 hours a day, you would be doing them in 3 2-hour sessions. So you, let's say, do 8 to 10, then you'd have a little break, and then you do maybe, I don't know, 12 to 2, and then you'd have a 2-hour break. And so you want to break it up into 2-hour sessions or 2.5-hour sessions to get all of it in. During that 2-hour session, it is again broken down into, as you said, Shannon, let's say in a 2-hour session, I'm going to do probably anywhere, depending on the child's rate of learning, I'm going to do anywhere between 10 and 15 different lessons. Okay. And again, depending on the child's needs, I'm going to repeat the lessons that are more necessary. So if this is a child who really needs to learn to make choices because right now they tantrum when there's a choice, or if there's a lot, depending on what the child needs, I'm going to repeat that over the 2 hours time frame. And if they don't, then I'm going to have like 15 different lessons. What are those lessons? I'm going to definitely want to do, again, it depends on the deficit area. So I'm definitely going to have a few in language, a couple, 2 or 3 lessons. It could be very different things. So if it's a non-vocal child, I might be doing imitation of sounds. I might be doing manding, which is requesting items with a vocalization if the child can vocalize. And then let's say I'm going to, depending again on the child and where they are in the program, I might be doing some tacting, which is identifying things in the environment. Or the program might be completely receptive in the language area, which is just identifying things by pointing to or giving or touching. So, but they're language based. So there's like at least, let's say 2, maybe 3 lessons in the area of language. I will do probably some things that have to do with just organizing the brain, as we were talking about earlier, which would be things like matching of items, putting them in categories, etc. Then I will probably be doing some play-based if it's a 3-year-old, and those would be teaching the child play skills that interest the child, but also would be ways that the child can later interact using those skills. So they would just teaching the child how to play with things. Initially, it would be, let's say, specific toys that have a completion, like let's say puzzles or those things that you put on top of each other. Later, it'll turn into more constructive play, imaginative play. It changes in form as the child's age changes, right? So that's a second area. Depending again on the child's level of skills, I'd maybe be doing some social activity. I think honestly with 3-year-olds, most of what I tend to do is first complete some of the language stuff, because it's very hard for a child who's 3 who doesn't understand language. So I'd really be focused more on language than any other area, but I definitely would do also some play, some social. Again, if the child has motor deficits, I'd be working on those. There would be some adaptive skills for self-care type things. I'd want to make sure my child is potty trained at 3. A lot of kids that we see are not yet potty trained, so we do focus on that. I'd want to start teaching the child basic things like brushing their teeth, brushing their hair, washing their face, getting dressed. Those are very important adaptive skills that the child needs to know. And I would probably not yet do any, the cognitive skills tend to start closer to 4 or 5. Executive functions, yes, maybe. If the child hasn't developed basic executive function skills like, being able to track people's eye contact or being able to point to objects, I'd want to teach that. I would joint attention, right? That's like kind of being able to track someone's eye contact and being able to figure out what they're thinking about. I would, depending again on the child, I might do some inhibition skills. So, if the child has also symptoms of ADHD, which a lot of our kids do, and they're kind of very not able to sit calmly and pay attention to something, I'd focus on that behavior. I'm not even talking about challenging behaviors right now. So, if you have a child who is, let's say, hitting another child in order to gain access to an object, I want to work on teaching them alternative ways of dealing with that. So I'm thinking more in terms of the lessons. I think those would be the areas, but again, it depends. Like, where is the child's language? Do they know do they use pronouns? Do they know their prepositions? Are they forming sentences? If they're not, I really want to teach them some, do they describe items? Do they know how to label things, label actions? Because if I want to teach a child, let's say, to not tantrum, then when they want to go outside, let's say, that I need to be able to teach this child how to request going outside, which means I need to teach them a few verbs, action items, like I want to go swing, I want to go run, those types of things. which means I need to go through a whole series of language lessons so
Yeah.
that I'm sure they are able to use that in their
Right.
speech. That's why early programs are very focused on language, because it's their means of communication.
Yeah.
Communication, the better you communicate, the less frustrated you are, the less challenging behavior you have. So the initial focus is very much language based. So those are the types of lessons. Now, when I say, let's say I'm doing a lesson on, let's say I'm teaching the child prepositions, whatever, where's the object? It's underneath something else. Put this object on top of. Go bring the thing that's in your closet. Those types
Right.
of things. As I'm doing that, it's not like I'm only going to focus on one preposition at a time. So and then when that's mastered, I will bring in a different preposition. So that's why lessons, an individual lesson like prepositions might last 6 months, because I'm teaching one of them and then making sure the child learns the second one and can alternate between the first and second. There's procedures in here.
Yeah.
But it only lasts for, let's say, each time I sit down with the child, it's maybe 3 minutes or
Yeah.
maximum 5 minutes. And then we go and do some sort of play activity
Right.
or something that's rewarding. So this is, the whole program is very, very rewarding, and it's based on the child's, the child has to be okay with it, right? And then I'll rotate from prepositions, let's say, to verbal imitation of sounds, and then I'll go on to, let's say, a little bit of play, and then I'll come back and do, I don't know, object labels, and then I'll go. So it's all just like that, right? And it alternates so the child is not bored, so that there's always new things coming, so that all the skills that I need to teach are kind of mixed in there for the child. And that's how the day goes by.
And if you're listening, 2 things, like if the child, you mentioned if the child's nonverbal, you start there and getting them to make sounds or icons or whatever.
Exactly.
But I want you to know, even listening to it now, I feel overwhelmed. I feel like, oh, there's
It's
so
very
much.
scary because
There's so much. How will we ever get where we're going to? There's so much.
Yes.
Like it literally, like I have a sense memory of like being there and
Worried
going,
the
oh my
whole
gosh,
time.
there's so much for him to learn. He'll never, ever get there.
Right.
And yet I'm on the other side.
Yes.
And I can't tell you
This
how
is trauma
grateful-
you've gone through because you're just worried the whole time.
But
as
I
a
also,
parent.
the level of gratitude that I have, I've shared many times before that, when he was first diagnosed, that, in my depression and grief about it, that, the shameful thing that I admit to was that there were days that I used to leave in my car and pray that I would be in a car accident.
Oh, gosh.
Not that I would die, but that I wanted, it's like, can I just be in a coma for the next 8 years, because I don't think I
don't
can
wanna
do
deal
this.
with this, yeah.
Well, I don't think I can. I
Yeah.
don't think I'm the parent who can
Right,
deal
right,
with this.
right,
And so
right.
somebody
Oh,
else will deal with it
gosh,
and then
gosh.
wake me up when it's over.
Right.
And there are times when I'm like, oh gosh, I've been woken up and it is over and I don't know how we got through it.
Right.
But the thing I say to parents all the time, we did. One day at a time, just
Yeah.
like when you climb
Yeah,
a mountain,
yeah.
you see the top of the mountain, but then you get busy climbing the mountain. And when you're on the mountain, you
Yeah.
can't always see the
How
top.
can
You
I
got to
do
keep the
this?
picture in your
Yeah,
head
yeah.
of where I'm going.
Right.
And we did it, and I am sure that if I could do it, I have trouble doing small things all the
Oh my
time.
God.
And if I could do it, I want to say to parents, if you're feeling overwhelmed, I get it, but it's doable.
Yeah.
And I'm not
Yeah.
the only parent that I know. I couldn't be the only parent that I know. I had to have people showing me along
Yeah.
the way. We have parents who can tell you how they got through it. But I know that if you want it,
Yeah.
right now, used to be that I would have to say to you, well, you got to go figure out the funding first. But most of you who are listening to me have the funding. You may not have access to the services,
Right. Right.
which is the opposite of what we had before. But there's more and more ways.
There's more and more ways, and don't worry, you can do it, and there are a lot of people who will help you do it. So,
Yeah. You aren't alone, even though
you're
you
not
feel
alone.
like you are.
Exactly, and you just made me realize sort of how overwhelming it is, you
Oh
know.
my gosh.
And from our perspective, it's just not, because we know how to do it.
Yes.
And it's fun and it's exciting because your child is learning new things, and always seeing your child learn new things is exciting and fun.
And when you start to see your child learning things, you will get the level
You'll
of
be like,
excited
oh my
they
God,
are.
this is amazing.
I always loved to be around the BTs because I remember thinking that the potty training was like, you know, were we ever going to get that? Just seemed insurmountable.
Yeah.
And you guys are all like, oh no, like, you know, we'll get
No,
that.
no, oh no,
Like it
the
was
potty
just of
training is
course.
not a big thing. Yes,
It was just
not
of
at all.
course. And to a parent, you're like,
How are
really?
we doing this? Yeah.
really? Is there's a, of course? I like
Yeah.
tell me more, please.
Yes.
Tell me about the bunnies, George.
Yes.
Uh,
Honestly,
You
it's
know
so
what I
true.
mean?
Yeah, absolutely.
And so, but you know, and I see in the BTs too, when we bring in new BTs, you can tell when somebody's going to stick because there's a moment when they're learning how to do things, but there's a moment when the child learns something, and it's a little, you know, it's addicting. It's like crack. You see them go,
It is. It is.
oh, they got it.
That's
What
right.
else can they get?
That's right.
And the same thing happens with a parent. When you start to
Yes.
see, okay, my child just learned that. It
Yes.
just cracks open the universe
Yeah.
for you. And I remember it was Ryan Bergstrom who taught me something that changed everything. And I said to him, okay, now you teach me everything you know.
Yeah.
Like start the download,
Yeah,
you know?
Yeah.
Uh,
Well, that's a kind of, it's so important, Shannon, when we talk about this, because like I want parents to realize that no one is going to be more motivated than you. So you need to be pushing everyone, like honestly, because, you know, in the old days and when you're talking about your therapists, they were incredible people who were still incredible people who were just very motivated to push. And this is what I was talking about a couple of weeks ago in the whole concept of recovery, right? And the
Yeah.
concept of how far can I push this child? How many skills can I teach this child? How far can they go?
Yeah.
And we always had that vision of that kind of North Star that we're following, right? And if you don't have that, and let me just tell you, I see less and less of that in the entire industry. And part of that is just parents, because you have to believe in this. You have to believe that you can teach your child everything. You have to believe that. If you don't believe that, no one is going to shoot for that.
Yeah.
That's the point. It's like you must believe that the highest outcome is possible, and you have to keep pushing. And I can tell you that parents who push always get further than parents who don't push.
Yes. Yeah, we need to be pushing, but build the world in your head that you're pushing and that they're having fun.
They're
Like
having fun.
don't leave
They
that
are
out of
having
it.
fun, right?
But because that's an
But
important
so
part of it.
A very important part of it, and I'm so glad you said that, because maybe pushing is not the word. Maybe what I should be telling you is you have to believe in your child.
Yes.
You have to believe that they can learn.
Yeah.
And if you believe that, then you will want them to learn more and more and more and more. And that's what this is about. It's just wanting them, believing that they're going to learn everything we throw at them. And that's important.
And I believe in the power of creative visualization, and that,
Yes.
and I it was something that I practiced earlier in my life, and then I had a child with autism, and it, kind of
Threw you off.
it came back to me because I had
Okay,
lost the
good.
way before, and it came back to me, and so for me, and I tell our parents this too, is get a picture in your head that is a specific thing, and that's your North Star, and that's what you're moving towards. And the thing that I talk about was that mine was that my son was going to be graduating from high school. He was going to be in the cap and gown, and I was going to stand in front of him and say, look him in the eye and say, we did everything that we could, and now the world is your oyster.
Yep.
And every day I would visualize that picture, and when it got hard, I would visualize it more. And then I've had that moment twice, once from high school and once from college. And everybody knows, and everybody takes a picture of it, and they're like, she's having the moment.
Yeah.
But we got there.
Yeah.
And whatever your picture is, there was another one too that we didn't have a porch swing, but I'm going to cry now. I said to my husband, I wanted to picture me on a porch swing with my son, looking up at the stars and talking about the big things in life. Not like, this is a dog but why do people think what they do? Why do people do what they do?
Oh, he's so far past that.
Oh my gosh.
He's so
And
far
we have a
past that.
porch swing, and we have sat on the porch swing
Yeah.
and looked at the stars and named the stars and had the conversation.
Yeah.
So we're out of time, and I had more questions.
Yeah.
And I got emotional.
And we can hit them next time.
Okay. I really want to thank you for
It's a
everything that you
pleasure.
do,
Thank
every
you so
breath you
much.
take,
Thank
every
you, Shannon.
every single thing,
Thank
because it
you
all
so
leads
much.
to goodness.
Thank you very much. And happy belated birthday.
Thank you. Thank you. And I want to thank all of you guys for sticking with us and watching, and for the people who will watch this in the future, for being the kinds of professionals and parents and people who take this stuff to heart, because you are the people
Yes.
that are getting it done. But please take the opportunity to think about what you want for yourself or your child and how you're going to get there.
Beautiful, yes.
All right. We're having a wonderful self-advocate who's joining us tomorrow, who's going to be talking about all kinds of things, and
Great.
especially, destigmatizing autism, the name autism. So we'll be talking about that tomorrow. So join us then. Until then, give your kiddos a hug from me and one for you as well. Bye-bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.